Frequent headaches. When blood pressure rises sharply, the tiny arteries in the skull and brain experience intense internal pressure, forcing them to dilate and stretch beyond their normal range. This stretching irritates pain-sensitive nerve endings surrounding the brain's outer layers, producing a deep, pulsating headache that is most noticeable at the back of the head or behind the eyes. The discomfort is often strongest in the morning, when blood pressure naturally peaks after sleep. Unlike tension or sinus headaches, these headaches feel heavy and resistant to usual pain relief because the cause is vascular strain, not muscle tightness or congestion. The pain may also coincide with sensitivity to light or a sense of pressure inside the head due to the increased blood flow resistance. Chest pain. Extremely high blood pressure forces the heart to pump against excessive resistance, making the heart muscle, especially the left ventricle, work harder to push blood out. Over time or suddenly, this strain limits oxygen delivery to heart tissue. The result is chest pain or tightness that can feel like squeezing, heaviness, or burning behind the breastbone. In some cases, this happens because the coronary arteries cannot widen enough to supply the heart under such high pressure, creating a mismatch between oxygen demand and supply. The pain may spread to the neck, shoulders, jaw, or left arm, and can worsen with physical activity or emotional stress. This signal always indicates that the cardiovascular system is under severe stress and that blood pressure may be reaching dangerous levels. Breathing difficulty. When blood pressure rises to extreme levels, the heart's left ventricle struggles to pump blood efficiently against the heightened resistance in the arteries. This can cause fluid to back up into the lungs, leading to shortness of breath or a sensation of not getting enough air even while resting. The fluid buildup, known as pulmonary congestion, prevents oxygen from transferring effectively into the bloodstream. People may notice that they need to sit upright to breathe more comfortably or wake up at night gasping for air. This symptom reflects the strain high blood pressure places on the heart's pumping function, signaling that the cardiovascular system is being overwhelmed and cannot maintain normal circulation under pressure. Blurred vision. Severely elevated blood pressure can damage the delicate network of tiny blood vessels that supply the retina, the light-sensitive layer at the back of the eye responsible for clear sight. When these vessels become thickened, narrowed, or begin to leak due to the stress of high pressure, visual clarity declines. This condition, called hypertensive retinopathy, can cause blurring, dark spots, or even sudden temporary vision loss. The retina may swell from fluid leakage, and in extreme cases, small hemorrhages can occur within the eye. Because these vessels are among the smallest and most fragile in the body, vision changes often serve as an early clue that blood pressure has reached levels high enough to injure other vital organs, such as the kidneys and brain. Nosebleeds. A sudden surge in blood pressure can cause the fine, fragile vessels inside the nasal passages to rupture, leading to spontaneous nosebleeds. These vessels, located close to the surface of the nasal lining, are highly sensitive to pressure fluctuations. When blood pressure rises abruptly, especially in the upper ranges, the added force can overwhelm these small vessels, allowing blood to escape from one or both nostrils without warning. The bleeding is often more profuse and harder to stop than ordinary nosebleeds caused by dry air or irritation. While not every nosebleed indicates high blood pressure, when they occur alongside pounding in the head, flushing, or dizziness, they reflect the body's response to excessive vascular tension and the strain within delicate capillaries. Dizziness. Prolonged or poorly controlled high blood pressure can gradually affect blood flow to the brain, leading to episodes of lightheadedness or imbalance. This occurs because chronically elevated pressure stiffens and narrows arteries, reducing their ability to regulate steady blood flow when you change position, such as standing up quickly. The brain briefly receives less oxygenated blood, causing a spinning sensation or momentary loss of stability. In addition, hypertension can damage the small arteries in the inner ear, where balance is controlled, further contributing to dizziness or unsteadiness. Although dizziness alone is not diagnostic of high blood pressure, when it becomes frequent or persistent, it signals that vascular control and circulation to vital areas are being compromised over time. Edema. Chronic high blood pressure forces the heart to work harder, which can eventually weaken the pumping efficiency of its left ventricle. When this happens, blood returning from the body is not pushed forward effectively, causing fluid to accumulate in tissues, a condition known as edema. This swelling typically appears in the feet, ankles, or lower legs first because gravity draws fluid downward, but it can also occur in the hands or around the eyes. The excess pressure inside blood vessels causes fluid to seep through the vessel walls into surrounding tissue. Over time, this visible swelling reflects deeper cardiovascular strain, as the circulatory system can no longer maintain proper pressure balance between the heart, vessels, and kidneys that regulate fluid removal. Fatigue. Long-term high blood pressure gradually exhausts the heart and reduces the efficiency of oxygen delivery throughout the body. As the heart muscle thickens to cope with constant resistance, it demands more energy yet pumps less effectively. This inefficiency means tissues, especially in muscles and the brain, receive less oxygen and nutrients than they need, producing persistent tiredness even after rest. Additionally, hypertension often disrupts sleep by contributing to nighttime awakenings or conditions like sleep apnea, which further compounds exhaustion. Over time, this constant fatigue signals that the cardiovascular system is overworked, struggling to maintain normal output under sustained pressure, and that the body's energy regulation is being undermined by inadequate circulation. Ringing in the ears. Ringing, hissing, or whooshing sounds in the ears, known as tinnitus, can appear in people with chronic high blood pressure because of the extra force exerted on the tiny blood vessels near the inner ear. When these vessels are under strain, the increased blood flow can create turbulent movement that produces an audible pulsing sensation, often matching the heartbeat. This is sometimes called pulsatile tinnitus. Over time, stiffened arterial walls and reduced vessel flexibility make these noises more noticeable, especially in quiet environments. Although tinnitus can have other causes, including earwax buildup or medication side effects, persistent ringing linked to high blood pressure indicates that vascular changes are affecting the auditory system's delicate circulation. Irregular heartbeat. Chronic high blood pressure thickens and stiffens the walls of the heart's main pumping chamber, disrupting the normal rhythm of electrical impulses that coordinate each beat. This can lead to arrhythmias, heartbeats that feel fluttery, skipped, or racing. The most common type linked to hypertension is atrial fibrillation, in which the upper chambers quiver instead of contracting effectively. The irregular rhythm reduces the heart's ability to move blood efficiently, causing sensations of palpitations, weakness, or shortness of breath. Over time, the constant pressure load also enlarges the heart muscle, further distorting its electrical pathways. This instability in rhythm is one of the clearest signs that long-term high blood pressure has begun to alter the heart's internal structure and function. No noticeable symptoms at all. And the most common hidden signal of high blood pressure is no signal at all. Many people live for years with dangerously elevated blood pressure and feel completely normal. Studies estimate that nearly 1 in 3 adults worldwide has hypertension, and about half of them do not know it. In the United States alone, roughly 120 million people are affected, and nearly 1/3 of those individuals experience no warning signs whatsoever. This means millions of people are walking around with blood vessels, hearts, and kidneys under daily stress without realizing it. High blood pressure progresses silently because the body gradually adapts to the increased pressure in the arteries. The heart muscle thickens to keep up with the workload, and blood vessels stiffen to withstand the force, so symptoms remain hidden until complications appear. By the time a person feels chest pain, breathlessness, or vision changes, significant damage to organs may have already occurred. This silent nature is what earns hypertension the title of the silent killer. It quietly injures blood vessels throughout the body, accelerating aging in the cardiovascular system and greatly increasing the risk of stroke, heart attack, kidney failure, and cognitive decline. Routine blood pressure checks are the only way to detect it early. Health organizations recommend that adults measure their blood pressure at least once every year, or more often if they have risk factors such as obesity, smoking, diabetes, high stress, or a family history of hypertension. Even if you feel perfectly healthy, consistent monitoring is the only way to know if your heart and arteries are truly safe. Don't just watch the world, subscribe and understand it.